Good afternoon, and thank you for joining us. My name is Michael Huff. I am the Director of Testing and Contact Tracing for the Office of Governor Tom Wood. And with me today is Debbie, our sign language interpreter. And Debbie will be removing her mask to better communicate. Thank you. As Governor Wolf and Secretary Levine and I have said many times in the past, the COVID-19 situation is fluid, and guidance continues to change over time, even after plans are prepared and adopted. But yet, the one thing that has not changed is citizens of Pennsylvania have individual responsibility to contribute to proper behavior and to adhere to public health guidance to protect themselves and others, as well as to help control the spread of COVID-19. Again, I want to reiterate, public health controls are only as effective as the willingness of individuals to carry them out. First, testing in Pennsylvania continues to increase. There are two types of tests we use, PCR tests and antigen tests, used both to identify COVID-19. PCR, or polymerase chain reaction tests, which is the gold standard, detects the RNA genetic material in the COVID-19 virus and are often collected via nasal, pharyngeal, nasal, oral, throat swab, or saliva. Antigen tests detect the presence of COVID-19 specific protein particles and is generally collected via a respiratory or saliva sample. The last 2 days of test results reporting in Pennsylvania have shown an increased amount of testing. Over the past 2 days, we've tested 111,838 PCR tests and 13,634 antigen tests. The total amount of tests to date is nearly 5,500,000 tests. That's over 43% of Pennsylvania's population. Average PCR tests received per day over the past 30 days is almost 50,000 tests a day. Average antigen tests received per day over the past 30 days is almost 4,700 tests per day. The total tests combined, 5,500,000, is an amazing number. And Pennsylvania continues to receive its allotment of Abbott Binex Now antigen rapid tests from the federal government. However, the number of tests received by Pennsylvania fluctuates from week to week, which presents challenges for distribution. Weekly distribution of these tests continues to the counties that are deemed substantial risk, as well as to the top tier of moderate risk counties, which totals about 5 or 6 counties per week, and prioritizes those counties with current disease outbreaks. The increase in testing demonstrates the increased need for case investigation and contact tracing. These are two key public activities that occur when a case of COVID-19 is identified. Given the continued concern in both the number of positive cases and the positivity percentage rate, the recommendations prioritization of COVID-19 case investigation and contact tracing have been enhanced. For example, in the last 7 days, there were 34,719 cases reported. 23% of these positive cases had investigations begun within 24 hours of reporting. An additional 7% had investigations begun 24 to 48 hours of reporting. Of those, only 25%, about 8,332, of newly reported cases were successfully contacted by an investigator, and 96 of these contacts refused quarantine. Why? Because people don't want to answer the phone. Because people do not realize how important it is to give the information that we need to make certain that we can control disease. We've heard many times from individuals that said, gee, I didn't realize how serious it was until my roommate had to go into isolation. And I didn't even get a chance to say goodbye. Or I didn't realize that by going to visit my family members and then being sick, that I could spread the disease to them. This is a challenge to all states across the country. Therefore, new key prioritization recommendations from the Centers for Disease Control were released yesterday and are meant to enhance efforts already initiated by the Department of Health. For example, we prioritize case investigation interviews for people diagnosed with COVID-19 in the past 6 days. And this is based on specimen collection date or symptom onset if we know it. We prioritize contact tracing efforts on household contacts exposed in the past 6 days and people living, working, or visiting congregate care living facilities, high-density workplaces or other settings, or events with potential extensive transmission. And as resources allow, expand our case investigation and contact tracing to people outside the household who are at increased risk for serious illness, part of a disease cluster, and exposed within 6 days. However, if more than 14 days have elapsed since the specimen was collected, case investigation should generally not be pursued. Within the 14 days, an individual that had the disease would most likely recover from the disease. The challenge here is, for those 14 days, without knowing that the case exists, the potential is that that case will spread to other cases. Therefore, we're unable to identify anyone who came in contact with those cases, do the contact tracing, give them the education that they need, and either isolate or quarantine as appropriate. Case investigation and contact tracing remain essential components of our COVID-19 response and are a key strategy to interrupt disease transmission and reduce spread in a virus and in the community. As the burden of COVID-19 worsens in an area and the capacity to investigate new cases in a timely manner becomes more difficult or infeasible, health departments will prioritize which case to investigate and contacts to trace, and emphasize broader community mitigation messages. Implementation should be guided by what is feasible, practical, and acceptable, as well as tailored to the needs of each community. As a reminder, the mobile app, COVID Alert PA, is an important tool that you can use to join the fight against COVID-19. I encourage you to download the app and use it daily. To date, there have been over 560,000 downloads and 42,781 daily check-ins on average. So please, remember to wear your mask, wash your hands, social distance, download the COVID-19 Alert app. Please avoid large crowds. Recommend holiday gatherings for your immediate household only. As you've heard Governor Wolf say, COVID-19 is tough, but working together, Pennsylvanians are tougher. I'll be happy to take questions.
Thank you, Director Huff. Our first question will be Sam Rulin. Sam, go ahead and unmute.
Hi, thank you for taking my question. I appreciate you doing this today. My question was, as we're seeing yesterday with the announcement that schools kind of have to decide now if they're going to go virtual or, continue to do in-person teaching, we hear that some of the parents are complaining about they don't find that there is any links to a big widespread kind of happening in the school systems. So I guess just with what you're talking about with contact tracing and just the fact that these schools in these counties are in the substantial territory, why, I guess, are these kind of new guidelines provided yesterday so important? And maybe what are parents or students kind of missing in the sense of them not thinking that there is a chance of spreading it in schools?
Thank you, Sam. I think that's the good news. The good news is if there aren't that many cases spreading, that's the way we want to keep it. And in light of the heightened concern and the danger of this particular phase that we're going through right now, we want to take as many measures as we can to continue to keep schools free of disease. And parents need to realize that this is the time of year when kids get excited, parents get excited, it's Thanksgiving, it's Christmas, and as hard as we try to stay away from crowds and put our masks on, there is still a possibility that disease could be taken into the schools. So it's extra caution, and it's very important that we all remain vigilant during this period of time.
And now I guess just my follow-up to that is, are you at all surprised that schools haven't sparked as many outbreaks as health experts did anticipate they would originally?
I don't think that anybody's surprised about anything with this disease. What is happening now is that for a time, the data told us that children were not as susceptible to the disease. However, now we know that everybody is susceptible, and it's across the board. So we are just being extra vigilant and very careful, and we hope that that trend continues.
Thank you. Next up is Erin McCarthy from the Philadelphia Inquirer, and on deck, Susan Shapiro from WJL. Go ahead, Erin.
Hi, Michael. Thank you so much again for doing this today. We've heard a lot recently about how small gatherings are leading to people spreading the coronavirus, but now we're seeing broader restrictions aimed, it seemed, at larger gatherings. Is that an indication that, in fact, all kinds and all sizes of gatherings are to blame for the recent uptick, or is it that it's just not clear because of a lack of data or contact tracing problems?
Thank you, Erin, for that question. I think it's indicative that in both of those settings, disease spread can occur very easily. Certainly in small gatherings where we become a little bit too free with our movement and perhaps don't social distance as much, we're less likely to wear masks. Certainly, we've seen a lot of data that demonstrates that cases are identified out of those groups. Even more so in large groups where people are less likely to wear their masks because they think they're social distance. If the large group is in an environment where folks are being loud and laughing, that all transmits disease. So we see it in both, and again, it's out of an abundance of caution that we want to make sure these mitigation efforts are addressed and followed, and we can see these cases and potential deaths flatten significantly.
As a follow-up, were you able to trace any cases or outbreaks to post-election celebrations or protests or sporting events or any larger gatherings like that recently?
We have not identified anything. I really don't have that data in front of me. It's not something, but we will certainly follow up with you. Anecdotally, I'll tell you that certainly the professional football, professional sports have seen cases, but give us the opportunity to get that data and follow back up.
Thank you. Next up is Susan Shapiro. Susan, go ahead and unmute.
I'm not sure if you can hear me.
Yes,
We can
Susan.
hear you.
Oh, okay, great. The rapid tests, there have been a lot of questions about the accuracy. What have you found in Pennsylvania?
Well, Susan, it's significant across the country. The accuracy, our main concern with the accuracy for the Abbott Binex Now rapid antigen test is that they may create a false negative. There's still a potential for a false positive, but our greater concern is a false negative. If you have a false negative and somebody goes on their way and they believe, okay, I'm negative, I can go out and socialize and I don't have to worry. Well, testing is a snapshot in time, and anyone that believes that they were a contact of a case and had a rapid antigen test should be followed up by the gold standard test I mentioned earlier, the PCR test. But I think the issue of accuracy is across the country. But don't let me dissuade you from the test. It is still a good test for us to do surveillance and identify where disease is, because we can always follow up with mitigation, we can always follow up with education, and if we have to, we'll do a PCR test to verify whether or not it was disease.
Susan, any follow-up?
No.
Okay, moving on. Sean Hamill from the Pittsburgh Post-Gazette. Sean, go ahead and unmute yourself.
Thank you. Mr. Huff, you mentioned earlier the COVID Alert app. What are you looking for in terms of impact, and have you seen any so far in the case investigations and contact tracing?
Thank you, Sean. Yes, we have. Actually, the app will basically notify the person that downloads whether or not they've been in contact. They're able to, they get a telephone number to call, and they can do their contact tracing via the app. They can do their contact tracing via a telephone call. And it gives us an idea of just how many people consider themselves well or consider themselves not feeling well that day as you check in. So it's a very useful tool. We continue to upgrade the app and get smarter and smarter with the app every day. In addition to that, this same app is available to about 7 or 8 other states. Some of them are contiguous with Pennsylvania. And as we continue to grow the use of the app, we will be able to identify things regionally as well.
And as a separate question, you mentioned that a very small percentage of people are actually answering the calls, and you said that they don't want to answer the phone. Why do you think people are not answering the phone? And then even within that, we've heard previously that there's a low percentage answering some specific questions, such as why, if they went to a large gathering or if they went to a restaurant. Why aren't people answering, and why are they choosing not to answer specific questions?
I think there's multiple answers there. I believe that clearly public trust is part of it. The fear of providing information to someone that you really don't know, providing the information to somebody that perhaps won't keep the information confidential, giving information that in some way may negatively impact the business that you attended, either having a dinner or a glass of wine. I think all of those are factored in. I think that and I've mentioned this before, if people are like me, I get a call and I don't recognize the caller, I'm less likely to answer the phone. So we're working on making certain that there's a trusted source, Pennsylvania Department of Health, County Health Department, Municipal Health Department, on the other line, so that they realize that this is a trusted individual, that it is a professional public health person with extensive training to include confidentiality and sensitivity to the kind of questions. The most important thing for us to do is to be able to reach out to that individual, get the information, give them education, and then move on to identify other people who may be at risk for the disease.
Next up is Nicole Ford. Nicole, go ahead. You are unmuted.
Hello. I had a question about testing. You said that it's being distributed to different counties just based on the need. Are you finding that we're low in some areas with tests? Because I know some people, especially trying to get tests for traveling for the holidays, are having trouble getting in at places.
Yes, Nicole. So 2 things. Let me talk about the travel first. The travel, having the negative test within 72 hours of travel. That is something that we are encouraging people, first of all, not to travel. We would prefer that they stay home. And if they want a test to meet that particular advisory, they would have to contact their healthcare professional or one of the commercial testing sites available. That would be a test that they would be billed for. As far as the other testing that are going to the counties with a substantial disease, most counties in Pennsylvania are to the substantial disease. I think our rate is somewhere around 11% right now, and 10%, anything over 10 and over, we consider substantial. In the beginning, 5 weeks ago, when we started the rapid antigen testing, there wasn't every county that had that high of a rate. But we are fast moving into significant disease, substantial disease in all counties.
So does that mean that moving forward, we may not have as many tests given out to those counties if more counties are needing more tests?
The intention would be to make certain that we have tests available to everyone who needs them. Pennsylvania has a very robust testing plan beyond just the antigen tests that I talked about. And those are the tests that the federal government had purchased from Abbott and distributed to states across the country based on a per capita rate. But in addition to those tests, Pennsylvania has a robust network of about 550 contracted sites across the Commonwealth that can also provide tests. Most of these, if not all of them, are PCR tests.
Hello.
Tiffany, go ahead.
Thank you. So viewers were showing concerns that someone who tested positive for COVID, when they get multiple tests to see if they're negative, if that person would be counted 3 times. They were just concerned on the accuracy of the numbers being reported.
Tiffany, I'm not sure I understand your question. Could you mind restating it for me?
Yeah, so someone getting tested who is positive for COVID, you're supposed to, kind of follow up and get retested. And if that would count, as 2 people being reported with COVID, viewers were concerned that the numbers seemed like more because people were getting follow-up. I didn't know how it was separated.
I understand now what you're saying. Well, I'm not exactly sure why someone who tested positive would have a second test unless it was a positive test with an antigen, then a positive test with PCR to verify that. In that case, I understand. But we report all tests based on the positive or negative. We do break it down into PCR tests and antigen tests so we can keep track of which test it may be. But I can tell you that there's not a significant number in there that I would describe as driving up our testing number.
Okay, next up is David Wenner from Penn Live. David, go ahead and unmute yourself.
Thanks, Mike. Hey, Mike, just to follow up, though, on the previous question, I would like to ask, for example, I've talked to people who have been hospitalized that talked about they were tested repeatedly until they eventually tested negative. Would those, like say if somebody wound up getting, tested 5 times or, over a period of 5 times in total, would that actually add a total of 5 positive tests to our result, even though it was the same person?
David, we're basically reporting positive tests. So if that person was tested 5 times, again, I'm not exactly sure why they are, but let me go back to the Department of Health and make certain that I can give a better explanation for delineating the multiple tests versus the positive tests.
Okay, and then I'd also like to ask, with thousands of new positive cases being reported daily now, with contact tracing, do we get to the point where it still is even practical or it still does any good?
That's a very smart question, and the short answer is we must continue to do contact tracing. What we have done is, as I described earlier, is really prioritize that. And if you think about the prioritization is for those individuals that are at the highest risk or of either other kind of health infections and disease and death, comorbidities, or for those individuals that could spread the disease to those people that are at highest risk. So we are narrowing it down to priority populations, but we will continue to work through that list. We're not going to stop because contact tracing and case investigations are basically the way that we can demonstrate what mitigation efforts are working and control disease.
Okay, next up is Judy Illick from the Daily American. Go ahead, Judy, and unmute yourself. Judy, go ahead and unmute. Okay, moving on, we have Sarah Bowden from WESA. Sarah, go ahead and unmute.
Hi, good afternoon. So with these new prioritization efforts, approximately what % of confirmed cases will receive contact tracing and case investigation?
Sarah, that's another good question, and I don't have the answer for that because it depends on obviously the number of people, the number of cases we have, and the number of people that actually answer the phone. Clearly, we're doing somewhere in the neighborhood of 25 to 40% of them, and we will continue to do that. The other thing that I didn't mention that I'd like to mention is that the Department of Health has done a really great job of kind of re-engineering the different roles in the area of contact tracing and case investigation. And let me just explain. In order to do contact tracing, first you have to have a case investigation where you identify a lot of demographic information as well as where the potential first contact was made. And then anyone that you have spent any time with, for example, 15 minutes in a 24-hour period, cumulative, that you could have spread the disease to. Those are the individuals that are then referred to contact tracers. And obviously, if the contact investigators can't get through all the cases, then perhaps the contact tracers don't have as many tracing to do. So we're shifting roles and responsibilities to increase more case investigators so that we can accomplish more successful interactions. So go ahead.
Oh, sorry, go ahead.
No.
Apologize. Follow-up question for you. When was this new prioritization sort of metric or hierarchy decided? When was that policy decided internally?
Well, Pennsylvania Department of Health actually identified that probably 3 weeks ago, their initial swipe at the prioritization, which was very successful. Just yesterday, CDC released new guidance on the prioritization, which is what I had delineated for you today.
Thank you. Next up is David Meikle. David, go ahead and unmute yourself.
Yes, hi. Thank you for taking these questions. The state has held testing events. I know we had one here in Reading. It was a week-long event where a testing center was set up in a large parking lot. I know they've been held in places with high case numbers, and particularly in places where there's high poverty or maybe lack of access to testing. With the holidays coming up and the specter of spikes in cases, is the state looking to do more of that kind of free testing for people who may not have access?
Absolutely, Dave. It's exactly what we're going to do. In fact, on or about December 2nd, you will see more of that type of activity. I explained once before the process by which Pennsylvania is going to do testing across the state. Now, let me just highlight that real quick for you. So we're calling it our public health infrastructure testing. And this is in addition to that 550 sites I'd already mentioned. We have areas such as county municipal health departments that account for 40% of Pennsylvania's population. We also have federally qualified health centers who have been tremendous partners with the Department of Health, who have actually 300 sites, and they represent both rural and urban areas. And in Pennsylvania, we have the public health network that consists of state health centers. And there are 60 of those in Pennsylvania counties. And each of those counties will be contracting with individual testers, such that you've seen in Reading, to provide testing for 5 days a week, 8 hours a day, and it'll be a moving testing site and available throughout that county. So the short answer is yes, we're planning that, and you'll start to see that early in December.